So the point that the committee was up to was putting clause 9 that it stand as printed. All those in favour say aye. Against say no. Aye. The ayes have it. Clause 9 will stand as printed. So the next amendment on file is amendment number 4, Schedule 1 from the member for Ghana, the inclusion of a new 9A to be added. Did the member wish to speak to that clause? Or move it to start?
Correct. I would like to move it, Acting Chair. So I move the amendment standing in my name. This is an important amendment for actually providing proper disclosure of pecuniary and personal interests. Let's keep very clear, firstly, the fact that these health boards are presiding over, in some cases, billions of dollars of health expenditure, of taxpayers' expenditure. And it is important that the public, the media, our health professionals have clear line of sight as to whether there are any potential conflicts of interest that may arise, bearing in mind that this was an area that was significantly raised by the ICAC Commissioner in the troubling ambiguity report that was handed down into the significant problems in SA Health. However, at the moment, the provisions that we have in relation to disclosing those are not working. And they're not working for a very simple reason that I think there was an understanding by the Parliament when they were originally proposed that these would be readily available from the individual hospital sites. What we have since found is that those health sites are denying access to those documents. They're doing it a number of ways. If there's a phone call or request made to a hospital or a LHN, an incorporated hospital under the Act, to view these documents of these registers, you are told, well, you have to come in, you're only allowed to view them, you're not allowed to take any notes or pictures, you're not allowed to take any copies of them, and then we'll take them back and hide them away again. Well, that is no proper transparency of what's going on. Certainly it doesn't help somebody who is living in one part of the state to find out what's going on in another part of the state where a significant amount of travel distance would be required. Or even if you're in your own health network, if you wanted to find out what's going on in terms of the Air and Western Health Network and you live in Ceduna, the head office is, I believe, off the top of my head, in Port Lincoln, you would have to travel a significant distance. You could only view them, you couldn't take any notes, couldn't take any pictures, couldn't take any copies. Well, that is not transparent at all. So what we're proposing is that they be made reasonably available for inspection by any person, that be replaced by made available for inspection on a website accessible to the public and reasonably available for inspection in hard copy by any person. So there's no reason why these can't be made available on a website for people to see. The only reason that the government would oppose that provision is if they didn't want people to see exactly what the conflicts were in relation to these very important boards which have the carriage of billions of dollars of taxpayers' expenditure.
Minister.
Thank you, sir. Thank the member for Ghana for the contribution. The government does not support the amendment. Under the current provisions of the Act, any disclosures of personal or pecuniary interests are required to be recorded in the minutes of meetings, which are subsequently already required to be published on the internet. The board is also required to record those disclosures in a register, which is to be available for inspection by the public. The public is free to access and peruse the minutes of governing board meetings at any time from the board's internet page. RLHN governing boards have the most extensive disclosure and conflict of interest requirements in the state, far exceeding those requirements for the other South Australian government boards, including SA Water, the Essential Services Commission and the Super SA Board. For example, the Essential Services Commission is subject to conflict provisions within its own legislation, which does not require the Commission to maintain a register nor publicly report conflicts. Provisions for the State Procurement Board defer to the requirements of the Public Sector Honesty and Accountability Act. This Act does not require the Board to maintain a register nor publicly disclose member conflicts. The TAFE SA and SA water boards are subject to the disclosure provisions in the Public Corporations Act 1993, which also does not require these boards to maintain a register. I humbly submit, sir, that the government would urge members to vote against this amendment.
Member for Ghana.
Well, thank you very much. Predictable rejection from this government in terms of providing transparency for its own operations, which we've become accustomed to over the past 3 years. I would be interested if the Minister could provide his explanation to the House in terms of what he believes the interpretation should be currently of what the law says in terms of reasonably available for inspection by any person. Does that mean that people should be able to be sent a copy if they ask a hospital board office for them? Should they be able to get a copy of them? Should they be able to take notes if they see them? What is the reasonable availability of them? Because what we have seen since this legislation was first passed was I think, an outrageous interpretation of that provision, that it's sort of like you seeing a secret document from the CIA or something is the level of transparency that's being applied here. So I think if the Minister could outline what the government's belief is in terms of how that provision should be interpreted, should copies be made available, should reasonable applicability be to provide a copy via email or other electronic means on request, then I think that would alleviate the need for this amendment. If that is not the interpretation, then I think that clearly there is a desire from the government to not actually provide what the law was intended to do, which is to provide reasonable access.
Thank the member for his rhetorical device. The government remains unconvinced by his submission for this amendment to be supported, and we would remind the House that what we are offering is indeed a level of accountability which is significant and which exceeds many other equivalent boards.
Member for Ghana.
Well, that is very significant that the Minister refuses to provide any detail in terms of how he or the government believes reasonable access should be provided, which only, I think, can lead to one conclusion. So the government will continue to do as they have done so far, which is not to provide reasonable access. And whether those decisions have to be appealed to, SACAT or the Supreme Court or something to get what the law has already agreed, which is reasonable access to those documents. I mean, the government's interpretation seems to be, we'll provide reasonable access, but they'll be buried in the desert somewhere and you have to go find them. That's reasonable access according to the interpretation of this government. The Minister is not providing any definition of what he believes should be provided at the moment. I think that would be helpful to do, because then there would be guidance for local health networks in terms of what they should have to do. In the absence of that, I think the Parliament should make it clearer in terms of exactly what is being described here, so that they should be available on the website. There's no reason why they couldn't be available on the website. Each one of us has our conflicts of interest available on a public website for people to see. Each one of us has what our conflicts are totally transparently available for people. Why should people who are on boards paid up to $90,000 a year not have the same transparency who are looking after billions of dollars of health expenditure? It is totally unreasonable for the government to oppose this clause, to oppose that transparency being applied to these so-called transparent provisions, particularly when the Minister points to the board minutes, which only, as I understand it, and feel free to correct me if I'm wrong, but I believe that I'm not, that the board minutes will only note a conflict if a potential conflict arises in that meeting. So you may have a whole range of conflicts between your provision on the Health Services Board of a particular local health network and what that board network does, but they will only appear in the network, they'll only appear in the minutes of that meeting if they actually revolve around what was actually discussed on that particular day in that particular meeting. So it's a complete fallacy to say that there's some transparency of these matters through just reading the board papers. There's not. There's only way to provide transparency is to reveal the register, which the government is refusing to do across its local hospital networks at the moment. And I hope that the parliament will see the importance of providing this level of transparency so that people can get an understanding of if there are conflicts in place, because we know that this is a serious issue that's been raised by none other than the ICAC Commissioner, and we should make sure that there are not appropriate conflicts in place.
Minister.
Thank you. I've appreciated the 3 submissions from the member for Ghana, but remain unconvinced and point him to the information that will be made available through the minutes that will be on the website.
So the question before the chair is that we put the amendment for Schedule 1, new clause 9A be inserted. All those in favour say aye. Against say no. The noes have it. Division is required. Ring the bells.
Time has expired. Lock the doors. Division has been called for in relation to the amendment in the standing in the name of the member Ghana, which seeks to insert new clause 9A. Ayes will pass to my right, noes to my left. Member for Ghana to tell for the ayes. Minister for Education is to tell for the noes. The result of the division, there being 19 ayes and 23 noes, the amendment is not agreed to.
To clause 10. If there any members have any questions on clause 10, if not, can I get an indication of when the next question the opposition may have in regards to a clause? 11. The question before the chair, therefore, is that clause 10 stand as printed. All those in favour say aye. Against say no. That is carried. Member for Ghana, clause 11.
Thank you very much. In relation to this clause, in relation to employed staff, has the government received any feedback from representative associations of staff to the effect as to whether this fully covers their concerns regarding employment arrangements and staff entitlements continuing uninterrupted?
I'm advised that this amendment was part was requested by the ANMF, and I understand that the Minister received correspondence in support of this clause as it is in the bill.
Member for Ghana.
And thank you. Have other representative bodies been consulted on this clause, and if so, what are their positions?
I understand that a range of representative bodies that I imagine the member would expect have been consulted on the bill, and I'm not aware of any advice other than that from the ANMF in relation to this clause.
No further questions from the committee in regards to that clause. Your next question, Member for Ghana, 13. So the question before the chair, therefore, is that clauses 11 and 12 stand as printed. All those in favour say aye. Against say no. That is carried. Member for Ghana, clause 13.
Thank you very much. This clause seeks to introduce requirements in relation to a healthy workforce culture for and among staff employed to work in the SA Ambulance Service, which is clearly at odds with what we're hearing on a daily basis from paramedics in our system in relation to how burnt out they are, in relation to their workforce fatigue, in relation to stress, mental health impacts that they have, also in relation to the bullying that we saw on the airways, in which staff were being told they might be threatened with ICAC if they spoke out in relation to their concerns, which had to be corrected and demolished by the ICAC Commissioner. So what reporting is done by the SA Ambulance Service in relation to the health, safety and well-being of their staff? Is there statistics kept in relation to the mental health impact on paramedics? What has been the impact upon the significantly higher workload, significantly higher ramping that's been experienced? What have we seen in terms of the impact upon return to work claims and other compensation claims that staff have been impacted by?
I'll take that on notice.
Member for Ghana.
Thank you. Well, if you're going to take it on notice, perhaps the Minister can therefore also take on notice in relation to how many workers' compensation claims have there been over the past 5 financial years in relation to the SA Ambulance Service, and how many notifications have there been in relation to staff having mental health issues because of their work over the past financial years as well?
I'll take that on notice.
Member for Ghana.
These objectives that are set, of course, sound very good, and we're asking the Chief Executive to put policies in place to promote workplace health, safety and welfare, including bullying and harassment. Of course, you would hope that those were in place already. So what is the government proposing to do to monitor how this provision is actually going to be implemented? What change are we likely to see because of this clause being introduced? What happens if the SA Ambulance Service don't meet these new objectives that are being put into the legislation? Or is this not going to have a material impact? This is simply some nice words to put in the legislation.
Thank the member for the question. If it's in the legislation, then it is the law of the land. The clause inserts an obligation on the SA Ambulance Service to promote a healthy workforce culture and implement measures to provide for and promote psychosocial health and wellbeing in the workplaces for which the SA Ambulance Service is responsible. It's an obligation on the SA Ambulance Service. This clause inserts an obligation on the SA Ambulance Service so that the culture and wellbeing of the workers within SAS is a focus of the entity. This is following discussions with Dr Chris Moyer, the President of the South Australian branch of the Australian Medical Association, who approached the Minister for Health and Wellbeing to seek his consideration of a similar proposed function of the local health network governing boards. And so this government is committed to improving workplace culture and staff wellbeing, as well as stamping out bullying and harassment, which we believe is unacceptable in any circumstance. That's why the government was more than willing to work with Dr Moy to accommodate this request and impose the same standards for the SA Ambulance Services for LHNs.
If there are no further questions from the committee, can I get an indication? Member for Ghana. New clause 15A. So if there are no questions from the committee, the question before the chair therefore is that clauses 13 through 15 stand as printed. All those in favour say aye. Against say no. That is carried. Member for Ghana, would you like to introduce your amendment standing in your name, number 5, Schedule 1?
Yes. Once again, this is a clause to... yes, I move the amendment standing in my name, number 5. This is a clause that would establish a fund that should be used to promote consumer representation in South Australia, representation of patients and consumers in the health system. One of the first things that this government has done upon coming to office was to abolish support for consumers through the Consumers Health Forum that we had in South Australia, the Consumers Health Alliance, which has been in place for almost 2 decades prior and had been representing the rights and interests of patients and consumers in the health system. We no longer have such a body in South Australia. It's the Consumers Health Alliance. We are the only state and territory that does not have such a body in place as the Consumers Health Alliance. We are seeing patients impacted on a daily basis of issues across the health system, and the fact that the government made it one of their first decisions shows how clearly they want to diminish the voice of consumers and want us to be behind every single other state and not having an independent body that would stand up for them. So this amendment is to stand up for them, to support an independent consumers body that should be provided funding by the government, as it was previously, as it is in every single other state and territory. And there is absolutely no excuse for why there would not be a statewide body to do so.
Minister.
Thank the member for putting forward this contribution and this suggestion. The government, however, does not support it. I note that it's a similar suggestion to one we debated in a previous sitting week, and warn members that my response may therefore have some similarities also to my response on that occasion. The state government has a strong commitment to consumer and clinician engagement in guiding decisions about the public health system. We recognise that partnering with consumers and the community play an important role in improving healthcare services. Funding a separate centralised body is not supported by the government. We believe it would result in unnecessary duplication and confusion given existing statutory mechanisms to ensure consumer engagement within the Healthcare Act 2008. A fundamental principle of devolution to the public health system is, sir, to bring clinicians and consumers closer to the decision-making in their local health services, to create a truly integrated approach to community engagement to support patients, carers, families and consumers and clinicians at the local level to inform service delivery. We do not believe it is appropriate under a devolved governance structure for the department to lead consumer engagement processes relating to local health service delivery, as the department is no longer directly accountable for these services or for determining how they will be delivered. As I believe I probably pointed out previously, through their existing statutory functions, which commenced on the 1st of July 2019, those LHN governing boards are responsible for establishing strong relationships with consumers, communities and frontline health professionals, particularly through the development of their clinical engagement strategies and consumer and community engagement strategies. Sir, the newly established Commission on Excellence and Innovation in Health, Wellbeing and SA and Mental Health Commission also play important roles in the engagement of consumers and clinicians. We believe engagement with consumers and clinicians is tremendously important. I submit to the House and encourage the House to provide the same opposition to this amendment as the earlier very similar one.
There are no further questions. Question before the Chair, therefore, is the insertion of new clause 15A. All those in favour say aye. Aye. Against say no. The noes have it. The noes have it. Question: the insertion of new clause 15A is not agreed to. Member for Ghana. 17. So the question before the Chair is that clause 16 stand as printed. All those in favour say aye. Against say no. That is carried. Clause 17. Member for Ghana.
In relation to governing boards for the hospitals, how many governing board members have either left or been removed since the enactment of the original legislation 2 years ago? And perhaps on notice, can the Minister provide a list of all of those members who have either left or have been removed and the dates upon which that occurred?
Look, I'll take that on notice to the extent that I'll bring back an answer that provides anything that is not already on the public record.
Member for Ghana.
In that respect, has there been, which I don't believe should necessarily need to be taken on notice, has there been any governing board members that have been removed as opposed to have voluntarily left since the enactment of the legislation? And if so, what were the circumstances in which those members were removed by the Minister under the Act?
Minister. Not that I'm aware of, as the Minister for Education representing the Minister for Health in this space. If the Minister for Health has anything to add, then I might suggest that the easiest way to deal with that is to include it in my response to the earlier question that I took on notice just before.
No further questions.
One further question.
Member for Ghana, your final question.
Yes. At any times since the passage of the previous legislation, has there been governing boards that have not had the requisite number of members appointed to them? And if so, which boards and for which periods of time were there not the requisite numbers of members according to the legislation?
Well, it's in relation to a health governing board, for example. I'm advised that the York and Northern LHN governing board does not currently meet the minimum of 6 members. However, an appointment to this board is imminent. I'm advised there's one other instance which a local health network governing board has not met the minimum of 6 members, namely the Carlin governing board had fewer. Mr. Atkinson would be most insistent. Fewer than 6 members for the 2-month period from the 3rd of April 2020 to the 29th of May 2020, which was the period in between a resignation and a new appointment.
Could I grab an indication from the member for Ghana in regards to his next question? I think that's it. So the question, therefore, before the chair is that clauses 17 and 18 stand as printed. All those in favour say aye. Against say no. That is carried. The question before the chair is that the schedule stand as printed. All those in favour say aye. Against say no. That is carried. Final question before the chair is that the title of the bill, the Healthcare Governance Amendment Bill 2020, be, pardon me, an Act to amend the Healthcare Act 2008 and to make related amendments to the Mental Health Act 2009 stand as printed. All those in favour say aye. Against say no. That is also carried. Minister.
Sir, I move the bill be read a third time.
It's been moved that the bill be read a third time. Is that seconded? Yes, sir. No further contributions at third reading. Therefore, the question before the chair is that the bill be read a third time. All those in favour say aye. Against say no. That is carried. Mr. Clark.
A bill for an act to amend the Healthcare Act 2008 and to make related amendments to the Mental Health Act 2009.